All right. Morning, guys. Corey Digman here from Digman Fitness. I want to go through really quick. We'll spend probably 20 minutes-ish on a 5-minute office series to help prevent injuries and help you guys in the long run, whether you're a recreational athlete or even someone that wants to prevent injuries at the office here. So the biggest thing we want to do first is identify what corrective exercise is, how can we use it, and there's common postural dysfunctions that we can go over, why that's the case, and then exercise that you guys can do right now as we're doing is kind of interactive, so this will be fun, and then some things you can do at home too. So first off, let's get started on defining what corrective exercise is. So corrective exercise is a way for us to enhance our posture, enhance our movement patterns throughout the day, or even help benefit our recreational sport. So if you guys are ultimate frisbee, soccer, whatever else you guys do outside the office, that's going to enhance and prevent injuries. So there are common alterations like your daily movement patterns. If I'm a construction worker, I'm pounding the hammer a lot, I might get a lot of tendonitis in my elbow, or for somebody at the office a lot, I might get wrist issues or even tendonitis in the elbow also. So we want to identify, make sure that obviously we go through physical therapist. If there's any issues with past injuries, you want to make sure those are cleared first. So my role is to identify a corrective exercise program by taking somebody through an assessment, and then also identifying those common postural dysfunctions too. So first off, we want to one of those, upper cross syndrome. So it's pretty common for those of us that are at the office. We have, you can see the forward neck, a forward head posture. There are tight muscles that are overactive, and there's underactive muscles that we need to recruit and get stronger to pull our shoulders back and pull our head in a position. We'll go through as far as assessments to look for static and dynamic assessments that'll look through and see like, okay, this is specific to you versus the next person.
There we go.
But the common postural dysfunction of upper cross syndrome is a lot of tightness in the neck and in the pecs, pulling the shoulders forward, and a weakness in the middle lower traps to pull the shoulders back. So we'll start with now, you guys can join in if you want. If I'm sitting, you can do this sitting, or if you're standing, you can stand up. Always good to get up and moving throughout your day also anyway. So first off, what we can do is left hand behind our back, pull that shoulder down, and tilt your head to the right. So make sure your head is square, tilt your ear to your shoulder, hold. Try to stay as square as you can. You can do this with me, otherwise you could just pay attention and watch. So 15 to 30 seconds. Most of the stretching that we do is at least 30 seconds, 2 times a day throughout most of the week. Activation stuff that we'll do, we'll cover in a second, which is at least a couple times a week for a few sets. Then I tilt my chin down slightly. So I'm looking at my armpit on that same side. So we hit upper trap, which is a common overactive muscle. And now we're hitting levator scap, which is a common overactive muscle that pushes our chin forward. And then we go up and back, same side. So I'm still tilting my head to the right. My left, I put that left back there because then it gets into the pec a little bit too. And then relax. Shake it off. And then the other side. Right hand behind your back, tilt your head to the left.
Oh.
This is probably going to feel really good if you guys don't do this very often. You're going to feel nice tension relief through the neck into the shoulder.
I can't even tilt my head. What are you talking about?
Yeah, if you guys are a little tight on this, that's okay. Just something to work on, but don't, if you haven't done this ever or a long time, don't use your hand and pull. That's only something you can do with a PT or if you're with someone like me or that you've done this in a while. So I wouldn't add any extra outside passive stretch on this. Chin down, hold. Looking down at that armpit. Might feel a good stretch down through the middle of the back too. And then chin up and back and over. Still got that right arm here, chin up. As far as a moneymaker stretch of like anything, for most people that have shoulder issues, this is going to be a really good relief. So if you remember any stretch that we go through today, the next stretch is going to be huge because this takes care of most of our issues throughout our whole body. So there's things that we have up here.
You know, there's people that aren't doing this.
That that cause issues
God.
into the elbow, into the wrist, or even in the.
Flip, that hurt.
A lot of the things we do are connected. A few more people I'm going to let in here. So that is more so, yeah. So the upper cross syndrome again, forward head posture, forward shoulder. We covered the neck stretches to kind of put this back in position. Now we want to pull that shoulder back. So obviously we want an assessment where if I'm looking at side view, front view, you can check yourself in the mirror at home, see if there's any of this going on, if there's a shoulder hike, or if you have a video, or if somebody can take a picture of you doing these, you can get an idea what's going on. Every 4 to 6 weeks, I try to reevaluate folks and see if some of the things that we're doing are working, and then go from there. So next up is a pec stretch. So if you can find a wall, I want my elbow up in line with my pec, my hand up. I'm going to reach back. I'm going to slightly turn away until I feel a good amount of stretch here. So this here, we weren't going to go the full 30 seconds, but just as an example. But I want this to be interactive for you guys so you get something out of it. It's easier to remember things if you're doing them at the same time as learning them. I'm going to switch to the other side now. Reaching back. Let's hold that for a second here while I keep talking. But if you have a corner, it always works great too. So arms up at 90 and then lean into that stretch. It'll get both of them at the same time. So that's going to be a great for those that if you have some kind of headaches, if you have past history of headaches, you obviously want to check your diet. Make sure if there's history of migraines, that can be a separate issue. But a lot of times headaches can be a cause of upper neck and pec tightness too. And then if you don't, treat these issues of tightness and lack of strength in the upper mid back, then it can be rotator cuff injuries or even head injuries. Okay. So there's the upper cross syndrome. Then we have a lower cross syndrome, which resulted from, like, if I'm doing a postural assessment, side view, front view. Okay. This was a side view of an anterior pelvic tilt. So my pelvis is kind of dumping forward. If I have a bucket of water, it would just kind of tip forward. That's what my pelvis is doing. From tight hip flexors, weak abdominals, tight mid back. So what I do is just kind of put this back in position by kind of reactivating, retraining the abdominals, not doing tons and tons of crunches, but more so of just feeling that tilt when you're doing your planks from now on, activated, okay, 15, 30 seconds, and then stretching that hip flexor. So we'll do some of that now. So first off, we can do a split stance position. So making sure that your feet are square, pointed forward. I want to drive my heel down to the floor like I'm squishing a bug, squeezing that back glute, okay? You'll feel that stretch here, just drive forward a little bit. You don't have to really arch and arch and arch on this. If you tilt that pelvis, push that heel down and squeeze this here, you should feel that separation. You can even add an overhead reach with that. It'll feel a little bit more intense all the way up through. So if my left leg is back, my left arm is going to go up 30 seconds each side. So you're stretching the calf, you're stretching the hip flexor. Then I go to the other side, making sure I'm square. Nice controlled step. If you don't feel it by tilting that pelvis, if you can't tilt the pelvis, then obviously we need to go through some manual stuff and see for sure. Tilt, squeeze, drive, reach. Always easier to do a lot of these things when you have an assessment and you can kind of have an action card. Good. So tightness and hip flexors, working the calf. I have a calf board in the gym that I use, or even a 2x4 you can do for calf stretches separately. There's an assessment that I do if I'm up against the wall, I'm on my knee. If I get at least a fist and a thumb between my toe and the wall, keeping my heel down, if I drive my knee to the wall without lifting that heel, that's ideal. There's a little restriction where if you can't quite get your knee at least past your toe without lifting your heel up, then your calves are a little bit tight. That's kind of a thing you can go through too that I do in the gym with folks all the time. So do that stretch, foam rolling. We won't cover any foam rolling today, but that's a good tool that you guys can use in conjunction with static stretching to both enhance recovery and range of motion. So a lot of cool studies out that are saying, hey, these are great separately, but they're even better used together, okay? So lower cross, what else? So injuries, so hamstring strain. So if there's a quad dominant, if the pelvis is not in optimal position, your gait changes, your movement patterns change throughout the day. And even worse yet, if you're in a sport, those movements change where you're going to have some injuries in the hamstring or even knee pain. So if you have knee pain, this can be another risk factor also. So adding in glute work also, along with those stretches. So if I do a standing version here, for you guys can follow along, keep that leg straight, kick back, squeeze this glute. It's all the further you need to go. Drive, squeeze. And then hamstring curl, same thing. So depending on your hierarchy, if you kind of fall into some of these categories, you can have some notes and say, hey, these are my top 3 stretches I'm going to do, or top 3 exercises. If you're not in the gym doing things already, you can talk to your trainer, physical therapist, and say, hey, can we do an assessment? Or you come to my gym, we can do an assessment, and you can find your top 3 or 4 stretches you can do within 5 minutes a day. That's kind of the whole headline of this, okay? Lower cross, what else? So glutes, abs, tibialis anterior. So this is more of a shin work. So driving the toes up, back down. This gets more prevalent for folks that are really active. They're out moving, walking, hiking, running all day. Then we need to do more footwork, which gets into our pronation distortion syndrome, our next common postural dysfunction. That is, so if you see over pronation of the feet, knees are knocking in, okay? Then we need to do, again, those tibialis anterior activation exercises. Okay, and working into stretching the adductors. So if you're seated, nice upright posture, drive the knees out with your hands, drive forward, stretching the inside of the hamstrings. Okay, again, some of you guys can do this as we're kind of going through as an example here. Okay. Working into the calf. I have a calf board we can use, or a 2x4, driving that knee over second toe on each side. 30 seconds to a minute, a couple times a day. And again, just like the lower cross, the pronation distortion syndrome also indicates the hamstring glute weakness. So you can do the kickbacks, or you can do hip ups. So if you guys are familiar with hip ups, deadlifts are great. Regular squats are good with a band, so you can have that resistance out. If you want me to show you some of the more examples of this at the end, if you guys have questions, we can do that too. So besides the 3 common postural dysfunctions, we have common injuries. So for you guys at the office, it's more so wrist and elbow. So some of those are, carpal tunnel, or golfer's elbow, or a tennis elbow, medial or lateral. So things to do with that are flexion extension work, and then maintaining strength. So there's a lot of research that says even with preventing injuries with the foot and ankle, it's great to have that range of motion and mobility in the ankle, but we also need stability, so that way our posture and our gait is optimal. Same thing with our hands. If we're constantly stretching and not strengthening, we need to have function. Our muscles and our body needs to be used to that impact over time to get stronger. So we want to both gain strength within here in our wrists and our hands, and range of motion. So the first one we'll do, if you guys want to follow along, is find a wall and do a wrist extension stretch. So easy position is hand or fingers up. Try to keep elbows straight. And if you need more of an intense stretch, if you don't feel much, the more you turn your fingers out or even facing down, it makes it more difficult. Don't start down here. And if you can't quite get your palms down, if it's really intense after a few seconds, then start here and work your way down. You don't always want to push a stretch too far too soon. Okay, again, just like every other stretch, 30 seconds to a minute. And then I do the other way. This is great for both any tendonitis in elbow or wrist. If you want something a little more intense, it's what I call a reverse prayer. So I just take my hands together in this position and then go down slowly until I feel stretch in the back of my arms or forearms. Okay, try to keep my palms together. Besides work you can do with a physical therapist, so sometimes I'll do cross friction release, either medially or laterally on just below the epicondyle on the elbow, to relieve some of that tension in the fascia along with these stretches. But for the sake of today, let's not do that since we're not as hands-on. We'll just cover the stretch and the strength portion of each of these. So the strength portion, if you have a tennis ball, you can do squeezes. Or if you don't, then it's fine. You can do what I call the penguin. So you guys can do this with me too, is extension, and flexion. Hold for a couple seconds each way, 12 to 15 reps. So if it's a strength exercise with reps, a good rep range is between 12 and 15. Or if it's a hold, usually 15 to 30 seconds, like on a stretch. Okay. You feel a little burning in the inside and the outside of the forearm. Again, you need activity, you need blood flow, you need strength. You also need to have a good length in that muscle, okay, to prevent injury. A couple more here. Okay. So again, let's review this before we do questions. What we're going to do is, if you, let's say you're coming in the gym and we want a program to get you better at golf. We would assess you specifically for your rotation, besides your posture assessment, see what this looks like if you have lower posture, pronation, distortion, any lower upper cross from each of these positions. And then we get more specific. So if you're somebody that's just in recreational exercises, we can get very general with your assessment and say, okay, here's your 2 or 3 corrective exercises with your push-ups and your squats. If you're somebody that really likes and enjoys exercise or is in a recreational sport, then we get more specific. So if you're a golfer, we need to check your rotational mobility. We need to find out if any gripping, rotating exercises hurt the wrist or elbow. Treat that with corrective exercise. And also with the shoulder, or even looking at the stability of your foot. So all that's important. So general to specific based on what your goals or your intensity of your sport would make sense in this portion. And then we develop action cards. So again, it's like 5 minutes a day on your top 2 or 3. So if it's a strength, 1 to 2 sets, generally 2 to 3 days a week, 12 to 15 reps. If it's a stretch or even foam rolling, research says, hey, we need to do this at least a couple times a day, if not once, every single day throughout the whole week to get results. So a lot of good research on the combination of foam rolling, more of an activation or what we call PNF stretching in conjunction for best results. So before we have questions, you guys can chime in. Just turn on your mic or your camera so I can see you. If I'm covering anything missing, let me know here too. I got some notes I have written up here too. So anybody have any questions? Now I kind of went through this fairly quickly.